Welcome back to Made to Be Whole. This week we're going to talk a little more about the intersection of physical and mental health. Stay tuned. Made to Be Whole is intended for informational purposes only. It's not intended to replace the advice or care of a licensed healthcare professional. Participating in this podcast does not constitute a provider-patient relationship with Krista Michener, AHP Integrative Health, or any of the guests featured on Made to Be Whole. Krista Michener, AHP Integrative Health, and any featured guests aren't responsible for any losses, damages, or liabilities that may arise from use of information obtained in this podcast or associated materials. Please consult a healthcare professional for any health-related concerns that you are experiencing. So today I want to dive a little more into the intersection of physical and mental health, because really it's more than an intersection. They are symbiotic, they coexist. You can't put your health or your soul into silos and say, here is my physical self, my emotional self, my mental self, my intellectual self, my social self. It all is one great conglomerate. And I've had multiple conversations, had another one this week that led me to ponder more about this when I hear people talk about individuals, sometimes themselves, but typically it's a family member who has a lot of mysterious things going on. And it's very easy, unfortunately, to point to that individual and say, well, they obviously have a mental health problem. You need better mental health services. You need a psychologist. If you had that problem, certainly it would have been found by someone else. And then that's a whole different level of trauma. And trauma affects healing. First of all, you can be physically and mentally unwell at the same time. I think that should not have to be stated, but I think it's really significant. I believe I've mentioned before, but when I worked in inpatient psychiatry, I would get really flustered because I would see patients who, some of them were quite dramatic in their presentation, but had these physical complaints. And you would hear staff say, oh, well, they're just psych. This is behavioral, yada, yada, yada. And sometimes really significant physical problems were missed that led to long-term physical complications that could have been fatal, weren't, but could have problematically been. So just because somebody presents as dramatic to you or because they have had mental health challenges doesn't mean that their body can't go wrong just like everyone else's, and that all merits investigation. And we've mentioned many times on this podcast, but I'll beat it into the ground, when there are new mental health problems specifically, look for a physical cause. If there hasn't been a new trauma or inciting event and somebody is suddenly psychotic, anxious, depressed, or those symptoms are worsening, you have to look at what can be driving this. A lot of times it's coming from the inside. To me, neurology and psychiatry are intertwined. I talk a lot about neuropsychiatry and neuropsychiatric symptoms and syndromes because I don't think you can really separate out psychiatry, which is really an individual's experience. We don't have excellent tests. We don't have objective measurements to diagnose mental health conditions by and large. We don't have imaging that we say, aha, X part of the brain is affected by this, ergo you have schizophrenia or bipolar disorder or anxiety or depression. We have some scales that are validated that we ask questions about whether or not somebody has less interest in normal activities, if they can enjoy life, about worry, about sleep. But again, that's just assessing symptoms and saying, yes, we call this constellation of things depression or bipolar disorder or generalized anxiety disorder or social anxiety disorder, but we're not looking any farther for that. We don't have blood work that we routinely use to diagnose those things. Thankfully, I think more people are looking for some of the low-hanging fruit, like a thyroid disorder, a B12 deficiency, a vitamin D deficiency, but rarely outside of the world of integrative medicine do I see people dig any deeper than that. There are actually specialized tests that can look at levels of neurotransmitters in your body and the metabolites of those neurotransmitters. So your dopamine, serotonin, norepinephrine, acetylcholine, those sorts of things. So that can be a really helpful clue for how to address someone's symptoms, but we still need to look further for root cause. A story that I told someone this week that I think is educational for everyone is about my son who is adopted. His name's Owen. He came to us when he was 14. He was in the foster care system for 10 years. His life inside the foster care system was not great. His life before the foster care system was not great. We were told unequivocally that all of his problems were due to trauma and neglect, that his developmental delays were because of neglect prior to placement. Of course, they kind of brushed under the rug the trauma that happened in the protection of children's services, but that's a whole other story. But we went with that. His trauma was severe enough. It was not difficult to imagine that that could be driving a lot of what's going on. And clearly, he did not feel safe. And that was completely understandable. Even though he came to our home and we said, "We love you. We're not sending you away." Other people had told him that before. And unfortunately, that wasn't how things turned out. Even though there were people in his past who really cared about him and wanted to keep him, he just had a pattern of being taken away or abandoned by people. So, of course, that's the low-hanging fruit. But interestingly, first of all, they kept talking to us about his medication. Well, he failed at this placement because his medication wasn't right. They didn't get his medication right. How do you think medication is going to change trauma? That's my first question. Even if it was, quote unquote, just trauma, how does medication change the past? How does an antipsychotic change the fact that you have perhaps been physically, emotionally, and sexually abused or neglected or abandoned? It just doesn't. It absolutely doesn't. There may be some people who find some symptom alleviation from some of those medications, and I'm not opposed to using them where they're beneficial, but there are a lot of people suffering from a lot of medication-induced side effects and very little benefit from what they're taking, because the answer that the system gives, the answer that insurance companies and healthcare providers give is we have to have a medical answer for this. That answer is medication, and that's pretty much what's covered. Thankfully, we are to a point where that is covered. For a long time, that wasn't. So we're glad that that is at least an option for people, but it falls very, very short of healing the whole person. So when Owen came to us, he was a little guy. He was like 80 pounds and 5'1". And I noticed, first of all, sometimes when he would have rage, he'd say something along the lines of that he was hungry, but he hated his body. And I thought, I wonder if this is related to the ADD medication that he's on, because those are stimulants that suppress the appetite. And it made perfect sense to me that this child was not able to pay attention because he didn't feel safe. Why would he want to sit in a classroom or sit and read a book or even watch a television show? He was not capable of doing that at all, because he was always looking around him to see what was coming. That's not ADD, that's trauma. So we did get him off that medication and he just shot up. He's now 6 feet tall. He's still really, really skinny, but that's genetics that don't come from us. So that was a key. Another key was that he had been on a lot of antipsychotics. And part of it was because psychosis had been diagnosed based on some of the things he said without looking deeper into the meaning of what he said. This is obviously personal and I hesitate a little, but he is 18 now and I feel like this can be helpful for other people. So he would talk about his voices. So clearly, when you talk about someone hearing voices, you think, well, they're psychotic. That's a psychosis. They're having hallucinations. We need to treat it with an antipsychotic. We had one really good therapist and a bunch of ones that weren't that great, but that's all right. We'll go with the good one, who said, all of these voices that he talks about, I really think that's just layers of trauma. He's been the only constant in his life. So he's had a lot of conversations with himself because he's the only person who was always there. So he's sitting there trying to work things out, talking back and forth in his head. And he called things his voices. But when we dug into it, I started to think, I really don't think this is the type of psychosis that is going to respond to medication if it's psychosis at all. And we also noted that he had what's called in medicine akathisia. It's this physical and internal restlessness where people cannot sit still. Again, you can say that's ADD, but we had a really smart NP we were working with his meds, and she said, I think that that's induced by the medication. So we got off the antipsychotics. We had some concerns because there was a lot of rage and aggression and other things, but lo and behold, he calmed down physically tremendously. He was able to sit and do more things because he wasn't on a medication that was wreaking this internal havoc. Some of the other things that were interesting, he had teeth that bothered him, and we were told by one of his caseworkers that it was psychosis related. He would say, oh, my voices are telling me to pull out this tooth. And the more I watched him, and he had had a dental cleaning and everything at that point, but I watched him and I thought, why would he be having this obsession about the specific tooth? What if there's something wrong with that tooth? And he wants to pull it out. And the language that he uses, because he's someone with trauma and developmental delays, is that his voices are telling him to, but maybe his voices or his internal whatever are telling him, take that tooth out because it's bothering you a lot. So my brother is a dentist. We took Owen down to have him look at it. And I was hoping for him to just give Owen reassurance that your tooth is fine. But Jared had a specialized x-ray machine, and he said, there's actually something really wrong with that tooth. So we took him to our dentist, who was great, took him to an oral surgeon, had the tooth pulled out because the root was infected. And guess what? His quote unquote voices don't talk to him about his teeth anymore. So how many times does somebody who doesn't have the culturally or intellectually appropriate or standard language to describe something has their symptoms dismissed as psychotic because they're not saying it in a way that resonates with us? They're not saying, I have some real discomfort in this one tooth. There's some pressure. I want to pull it out. It bothers me so much, but I think there might be something wrong. If he had the mental capacity to do that, he may have been taken more seriously. He might not have. I don't know. But it was a real wake-up call to me. I had a situation before of a patient who was told that they were psychotic because they were preoccupied with their bladder and had seen a urologist who had assured them that everything was fine and that this was psychosis. When we did specialized testing, we found strep in the urine, which is abnormal. Even though it's a low level, it still shouldn't be there. You treated the infection, and the bladder preoccupation and psychosis resolved. So that to me is really important. When we're listening to someone and we're listening to their complaints, can we separate what they're saying and how they're saying it from the content and what's driving that to make accurate decisions about what's going on with that individual? It's also very possible to have someone who is extremely dramatic and exaggerates lots of things in life, but that also has real physical symptoms too. And that can be really challenging as a provider, a parent, a family member, a friend. You've heard this individual go on and on about things that were unimportant. It doesn't mean when they talk about their body, even though they're doing it in a dramatic fashion, that what they're saying is incorrect and doesn't merit investigation. And one of the reasons I believe some people present that way is because they are stuck in a sympathetic state. So you have your sympathetic nervous system and your parasympathetic nervous system. You need both. Sympathetic is that fight, flight, or freeze. There's a bear or a lion. I'm either going to run, I'm going to fight it, or I'm going to try to camouflage myself and hide. And those are all very useful responses in that moment. But when you have what's been described by Robert Naviaux as the cell danger response and it doesn't get shut off, then you're stuck in this sympathetic state, which is really, really bad for your health. It's really negates your body's ability to heal. I have multiple acquaintances professionally and just friends I've had over the years who had a lot of health problems that resolved almost instantaneously when they got out of an abusive relationship. So when you're in an abusive relationship and you're not safe, your immune system really is redirected to other things. It doesn't care. It's not because they were in a traumatic relationship and were having imaginary symptoms. They were having very real physical things going on, but their body was trying to just survive. And when they got to a place of safety where they weren't being attacked or ridiculed constantly, their body was able to calm down and heal. And treatment that we had done before that wasn't effective becomes more effective, or anxiety medication that they needed for years, they didn't need anymore because they weren't in an anxiety producing situation. I think abuse is a really, really important thing to address. I have met a large number of people who, for cultural or religious beliefs, feel that divorce is wrong all the time, no matter what. And I strongly, strongly disagree with that. I don't think it's a decision anyone should take lightly because you've made a commitment to someone. But for marriage to work, it does take two people wanting it to work. And if you are giving everything, but you are physically, emotionally, mentally unsafe and being constantly attacked or ridiculed, that's not a place that you should be. That's not a place that you can thrive. You cannot fix someone else. And you need to be really, really cautious about continuing to be in a situation that is detrimental to your health, to your safety, to your children's health and safety, and to think about the message. This is a little bit of a side rant, but I'll give it. It's a such a hard situation to be in, to have children and be in that situation, because you want children to have two parents, but you also want to model for them self-care, and you want to model for them standing up to what's wrong. You have to do it in appropriate ways, but you've got to set that example of protecting themselves, because I've seen too many people fall into one or two patterns. If they don't have a parent that breaks that cycle, they either become the abused again or they become the abuser. They say, well, I'm not going to be like this parent who was taken advantage of. But then inadvertently, because all of those thoughts haven't been fixed, they become the one that is abusive, maybe not in the same ways. Or they say, well, I'm not going to be like the other parent who was really abusive and manipulative. But the only other thing they've had modeled for them is someone just taking whatever, and then they become the victim. So it takes a lot of conscious and extremely difficult effort to break that cycle. But if you are in a living situation where you're unsafe, it's going to be really, really difficult to heal. Only you can make those decisions about what and when to do. But I really would encourage you to look at what you can do to put yourself in a better situation and use the resources that are out there. And then also to focus on, with healing, things that you can control. There are some things you can't control. You may be a teenager or even an adult with health problems who's dependent on other family taking care of you, but it's not an ideal living situation. And you're kind of stuck, at least for the short term. So you cannot change the people around you. But there are things in your environment that I would encourage you to address. And those are even things like what you read and what you listen to. You don't need more toxicity from media. You don't need it from music, books, news sources. You have to be really, really mindful about listening to music that uplifts you, reading things that don't fuel your anxiety, trying to develop other relationships and friendships, and then looking for ways that you can be the helper, because it's really easy to be stuck in being the victim, but there's always somebody who could use your help. And I think that that's really healing too, to find situations where you can be a blessing to someone else. So, side rant over, I'll jump back to my son and some of the other things that we found were driving this mental health picture, in addition to the medications themselves and the trauma. So, one of the first things I did was nutrient testing that I've discussed extensively. And I remember the first test we got back, the deficiencies he had really lined up with impaired detoxification on one hand, and then the other hand, poor blood sugar regulation. And blood sugar regulation can really impact mood. If you have crashes, you have low blood sugar, you can become very anxious, agitated, depressed. It depends on the individual, but that's a pretty big deal. So that was a clue for me. Not only did I need to supplement, he was really low on chromium and biotin, which both affect blood sugar regulation. Supplement with things that help even that out, but make sure that he is eating regularly and that he's eating things that are going to stay in him a little longer. One of the next things I did, and I've mentioned this a little before, was the genetic testing or the genomics and Telix DNA. I did the neurodevelopmental panel. It did show risk for developmental issues, which he has, which were obviously enhanced by trauma and neglect. But I saw a tremendous difference. It helped me figure out, all right, what supplements are helpful, what are not? Is there anything I need to add or take away? Okay, this particular type of fatty acid can be great for this kid. I'm going to order higher doses that make sure they have these strains. We're going to add some ashwagandha to help with this fight or flight response. And then one of the things that was most magical was it showing that he has the gene that I've mentioned before, that in his brain, T4, which is one of your thyroid hormones, can't convert to T3. Even though blood levels might look okay, that poor conversion can manifest as anxiety. So we started adding T3, which is liothyronine or Cytomel, if you're using the prescription version of it. And literally within days, he was a completely different kid. All the problems were gone, but you could tell he was physically relaxed. He was calmer. He was able to enjoy things. So we got to the point that with doing all of these interventions, plus just sticking with it, which has not been easy because individuals who have been through a lot of trauma and have attachment problems are bound and determined to sabotage good things happening in their life just to get it over with, because something's telling them this isn't going to work out. It's never worked out before. You might as well just get it over with. So there was physical aggression, property destruction, running away, all sorts of really stressful things. I know it was more stressful for him than us, but it was really stressful for us too. We used neurofeedback for some of that. But there were a few things still kind of out there that I hadn't addressed. So one clue was that when he was supremely agitated, that nothing touched it except Benadryl. So when he first came to us and we had this aggression, agitation, outrage, violence, stuff that went on for hours, the provider we were seeing had even said, well, why don't you try Haldol, which is an antipsychotic, try Ativan. You know, we had given him those things, and at doses that would have most of us drooling on the floor, he did not slow down. It did not do a thing for him. But when I said, you know what, we're going to try some Benadryl, Benadryl brought it down a notch. It wasn't attempting to knock him out and put him to sleep. I was just attempting to keep everyone safe. And that kind of did the trick. And I thought, ooh, clue in the back of my head. That means that there's like some sort of inflammatory process going on, but a lot of things can cause that. I didn't really want to dive into the world of these vector-borne infections because I've got enough going on. Another clue, though, that might be an issue was this tooth thing. People with Bartonella a lot of times have atypical tooth pain and odd dental problems because Bartonella can demineralize teeth. I got some other clues from family history that made me think this could be an issue. But then my son Daniel said, you know, Mom, he's fine, but then he just has these occasional outbursts that look like the Pants Panda stuff that you've been talking about. He's fine, and then he just isn't. And he doesn't like feeling that way. He tells us he doesn't like feeling that way. What if there's more going on? So I kind of reluctantly ordered T-lab testing to see if there could be vector-borne infections present. And ta-da, Bartonella and Lyme are both there. And I really didn't want to know that, but I thought, you know, he came to us for a reason. This is something we can help with. And I'm being very, very cautious how we're approaching that because obviously I don't want to trigger die-off that's really distressing and someone that already has a lot of distress and is just starting to feel safe in the world and can't always understand everything that's going on. But I can't responsibly do nothing either. Let's not okay, because I know that unchecked, these things can lead to worse problems. And with proper treatment, that we can really alleviate what's going on and prevent complications and improve quality of life now. So the things that I'm starting on are just some herbal things at very low doses and titrating up very, very slowly to minimize any of that die off reaction. I actually reached out to one of my friends, Carrie Earlwine, who's a compounding pharmacist at InfuServe, who's done a lot with mental health and explained the situation. And he gave me some good ideas for some safe, natural things we can do to minimize distress in general, but then again, particularly in the context of knowing what Bartonella die-off can do for someone who already has distress and delays and wanting to help him still feel as safe as possible. So the point of all of this is not to dump my story or my life on you, but I just think it's an important illustration that we cannot categorize people as either having mental health problems or physical health problems, that we're very complex beings and the intersections are multiple. I mean, you've got interstates with on-ramps and off-ramps everywhere. It's not just like, oh, there's this one area where physical and mental health might overlap. Your physical health 100% can affect your mental health, and your mental health 100% can affect your physical health and your body's ability to heal. So if you have someone in your life, you or a family member or a friend or a coworker who is exhibiting physical symptoms that seem unusual, remind yourself this: if somebody was going to make something up for attention, couldn't they come up with something better than that? If somebody were really psychotic, what on earth, and in someone's past, would drive them to talk about one tooth wanting to be ripped out and bothering them? What could be going on? Their language is saying X, but what's underneath that? What's the behavior? And give them the dignity of digging deeper to see what might be missing. And remember, with all of these things, to be patient. It's all a process. We're complex beings, but there's much, much more hope and healing out there than I believe the mental health system would have us believe. Hopefully, because most people just aren't aware of other things. Partly because I think there are nefarious forces that want us to be solely dependent on the pharmaceutical industry, when really that should just be a tool in their toolbox. It's not the universal remote that's going to take care of everything. So thank you for tuning in. Send us any questions you might have, and remember to have hope, because you were made to be whole. Have a podcast question or suggestion? Text or call us on the podcast info line at 330-439-0686. Thank you for spending time with me today. If you like what you hear, please subscribe to be notified when new episodes release. And remember, you were made to be whole.